So as we know, in the last decade or two, the outcomes of patients with kidney cancer has improved tremendously. So as our patients with cancer live longer, brain is a sanctuary site. So we are seeing increasing incidence of brain metastases with kidney cancer. So much so that now kidney cancer has become the fourth most common cause of brain metastases after lung cancer, breast cancer, and melanoma. So we are seeing increasing number of patients with kidney cancer with brain metastases in our clinics every day. So we queried the national database looking at patients with primary renal cell carcinoma with brain metastases, looking at how they were treated, whether they received whole brain radiation, radiosurgery, or immunotherapy, or a combination of these approaches. Traditionally, patients with brain metastases had been treated with either whole brain radiation or focused forms of radiation called radiosurgery. But in the last decade, what we are finding out is immunotherapy actually is quite effective in treating patients with brain metastases as well. So what we found out in this database of over 6,000 patients, that patients received either whole brain radiation, which was one of the most common ways of treating these patients. Also, you need to understand that this is a fairly long period of time that we studied. Over 40% received whole brain radiation, 10% or so received either immunotherapy alone, 10% received radiosurgery, close to 10% received a combination of radiosurgery and immunotherapy. What we found out was that those patients who received a combination of radiosurgery along with immunotherapy actually did the best. The overall survival in these patients was close to 19 months. Most of the patients who were either treated with whole brain radiation alone, or stereotactic radiosurgery alone, or immunotherapy alone, or a combination of whole brain radiation or immunotherapy, they mostly had an overall survival which was close between 9 to 10 months. So this study actually showcases that using a focused form of radiation like radiosurgery may be a good way to combine with immunotherapy rather than just using these modalities alone or using immunotherapy with whole brain radiation. So in the last decade or so, radiosurgery has actually overtaken whole brain radiation as the preferred way of delivering local therapy to the brain. We also do know mechanistically that if you combine radiation with immunotherapy, you can actually have a synergy, because radiation, whether it's in focused form, it can act as a neoantigen epitope expression promoter. So in a way, radiation can be like a immunotherapy sensitizer. So the combination of immunotherapy and radiosurgery also does not have the toxicity. Sometimes when we combine immunotherapy with whole brain radiation, it can also be more likely to be toxic, because when you combine immunotherapy with radiosurgery, there is an increased risk of something called as radiation necrosis. So, but when you use focused forms of radiation and you combine that with immunotherapy, you do not have that high degree of radiation necrosis, but you do get the benefit of increased neoantigen epitope expression, which then boosts the benefit you can get with immunotherapy. So what this study confirmed is what we have seen in other cancers as well. So lung cancer, which is the most common cause of brain metastases, we frequently use immunotherapy with radiosurgery. We have seen the same thing in melanoma, where we often use radiosurgery and immunotherapy. So what this study establishes that, first of all, it is safe to combine immunotherapy with radiosurgery, and you also get better responses or improved survivals in this patient population. It becomes challenging when we go to small subtypes of tumors to actually do randomized trials. But the findings of the study will definitely generate more interest in looking at different combinations of immunotherapies with different schedules or different sequencing of radiosurgery, so we can even improve the outcomes of our patients and decrease the toxicities seen with these combinations. What this study also showed a great example of the progress that we've made in the last decade or two with our patients with brain metastases and cancer in general. Because almost a decade or 2 decades back, patients with kidney cancer, brain metastases, their outcomes used to be between 6 to 12 months. What we are seeing now that with radiosurgery and immunotherapy, the outcomes are 19 months. And if you stay tuned, I can predict that in the next decade or so, we will start hitting 2 years or more for this patient population, which is a great news for our patients, but it is also very exciting for people like me who are physician investigators designing these trials.